Some other symptoms that you might be dealing with more down the road would be hair loss, for example. You could be dealing with cancers, skin cancer, lung cancer, thyroid cancer, any of those. If you're dealing with direct extreme exposure of radiation, one of the first signs is probably going to be your skin. So your skin is going to show signs of erythema, meaning it's red, it's warm, it's very irritated, it's almost like a severe sunburn, or you might just have a different type of rash going on. And so that's going to lead us into treatment here in just a little bit. With all your blood cells being eradicated, remember that also means your platelets are going down the drain, and other cells as well. So your body's ability to clot the blood is not going to be present anymore. And that, like I said, is going to take between 2 to 6 weeks for all those different cell classes to recover. And so with direct organ damage, tissue damage, and also the effect on the blood cells, you're going to be dealing with a lot of internal bleeding. So with repeated nausea, vomiting, diarrhea, you might be throwing up blood, you might be, excreting blood, or you might just have constant internal bleeding, which is going to affect your blood pressure. So checking this patient's vitals is going to be crucial, and you want to watch out for signs of hypotension. Then again, infections are going to be our main concern for the weeks following the exposure, mainly for those from mild to maybe severe exposure. Anybody with extreme exposure, you're pretty much just going to be trying to keep them comfortable. But infections and poor wound healing are going to be your two main concerns. I put an example of stomatitis down there. It's pretty much these very, very painful sores on your mucosa, so mainly the inside of your cheeks, the inside of your mouth are going to be affected, but pretty much all the way down your digestive tract as well. And just to keep in mind, these symptoms can appear from just a few minutes to several hours, in some cases even days later. So, like I said, let's talk about treatment. One main thing is going to be hydration. If you can do it orally, great. If they're suffering from sores all in their mouth, their esophagus, their digestive tract, they're probably not going to be too keen on drinking anything, so you might have to get an IV in them. Control their symptoms, so mainly that is going to be nausea control the vomiting, try to control the diarrhea. There's different ways that you can do this. Of course, let's say for the diarrhea, you could use Imodium. For the nausea, the vomiting, you could use Zofran if you have it handy. You can use essential oils like peppermint, ginger, Roman chamomile. Those are very calming and are going to help control that. One of the big things that you have to look into is to control any type of infection. We're going to have lots of open wounds, lots of open sores. Things we're going to be looking for is to control infection. So you want to pick an antibiotic that has both staph and strep coverage. This could be your Keflex is going to cover both. If you don't have those available, amoxicillin is a good one to cover strap. And then you just need to add something on to also cover staph. So this could be your doxycycline, this could be your Bactrim, things like that. So just try to work with what you have in your stash. If you don't have anything to cover both of those, I really encourage you to get on that because those are going to be your most common organisms anyway. Also, if you want to go the natural route, you certainly can. Clove oil and oil of oregano are the two main ones that come to mind there. Clove oil in particular has been researched heavily, and it has been shown that viruses, bacteria, and parasites cannot survive when clove oil is present. So also good things to have in your stash there. Then what you also want to do is keep them in quarantine. Now, this is not to protect other people. It is protect the patient themselves. They're not going to have an immune system whatsoever, so they need to be in quarantine for at least those 4 to 6 weeks to make sure that their body has had time to recover. And then also you want to shield them from any type of other infection that other people might be bringing in with them. Then it would be great if you can somehow support the regeneration of their blood cells. In a medical application, this would be done through blood transfusions or CSF or colony stimulating factors that help the bone marrow regenerate itself, or then also natural remedies could be used for this. So for example, you want to increase their iron intake. This can be done through dried apricots, liver, kale, pinto beans even have a high iron content. You want to make sure that they don't eat anything that's going to inhibit their iron absorption. So this would be dairy, coffee, alcohol, anything that contains wheat. So that would be counterproductive. Then also there's lots of vitamins that are essential for your blood cell production. So of course this would be folic acid. You can just get that in supplement form, or again, beans, bananas have lots of folic acid. Vitamin B12 is another main one, so that would be in milk, but keep in mind, don't give that at the same time as iron-containing foods, green leafy veggies, meat, grass-fed butter, if you can find that. Or then also vitamin C is essential for the blood cell production. So bell peppers, kiwi, strawberries, things like that are going to contain vitamin C. The biggest one, especially if you get into the higher levels of radiation exposure, is going to be pain management. You can pretty much use whatever you have on hand. More than likely it is just going to be ibuprofen, naproxen, Tylenol, any type of over-the-counter pain management. If you have something topically that's going to be helping, aloe vera, lavender, those types of things are also going to be very helpful. Just try to keep them comfortable. And then also don't overlook the psychological aspect of this, both for the person that is affected themselves, as well as the person taking care of them and everybody around them, especially if it is family, friends, significant other, anything like that. So whether you have somebody in your group that is going to be in charge of religious care, or that's well trained in psychological care, that would be a really great asset to have. Two things I just wanted to point out really quickly. Of course, the VA has done a really good study on the long-term effects of radiation exposure, so go ahead and go to that link and read up on that. Also, Harvard published a really neat study in 2011. They found that if you combine a fluoroquinolone antibiotic, so that would be your Cipro type of antibiotics, with a protein that is present in our body anyway, it is the infection-fighting protein BPI, that has severely decreased the effects of radiation sickness if it was administered within minutes to a few hours of exposure. So hopefully there's going to be some new things coming out anytime. Let's talk about treatment options specifically to the radiation. So the main one that you've probably heard of before is going to be potassium iodide. There's several companies out there. I would personally stick with 3 of them. They have been well researched. They've been on the market for decades, and not that this means anything in general, but they have been FDA approved. So Iosat, ThyroShield, and ThyroSafe are going to be your 3 main ones that you should stick with, and just keep in mind that you have to take these within 3 to 4 hours of exposure. So the way potassium iodide works, it is mainly a protector for your thyroid gland. So your thyroid gland sits right in front of your trachea, there in the front of your neck, as you can see, and it is one of the most sensitive organs when it comes to radiation. So the potassium iodide blocks the receptors on the thyroid gland. This effect only lasts for 24 hours, but for that time, the radiation particles can't dock on to your thyroid gland, and so they can't damage this gland. But keep in mind, only for 24 hours. So the dosage that you're going to be looking at, this is going to come either in a pill form or a liquid. Pretty much you either have 65 milligrams or 130 milligrams, and most of the pills are in a way where you can easily cut them down for smaller dosages. So people that you have to keep an eye on are, of course, fetuses, infants, and then also those that already have hypothyroidism. Those are at highest risk to develop some type of thyroid damage from this radiation. So a newborn, so birth to about 4 weeks old, is going to get 16 milligrams. These are all one-time dosages. You really never want to have to repeat this dosage. Infants, so a month to 3 years, are going to be 32 milligrams. 3 year to 18 is going to be 65 milligrams unless they're already at the weight of an adult person. Young adults, so in medical terms, this is usually 18 years through about the age of 40, are going to take a single dose of 130 milligrams. This is also going to be no different if a woman is pregnant or breastfeeding at the time. It's going to be a one-time dose of 130 milligrams. If you're over the age of 40, there isn't going to be any treatment necessary, simply because you have the lowest chance of developing thyroid cancer in your lifetime, but also the highest chance of actually being allergic to iodide. So as I had mentioned previously, you really want to try and avoid taking the potassium iodide more than once if you have to. However, it is a possibility if you think that exposure is still likely. The only people that it is absolutely contraindicated in would be newborns, pregnant women, and also women that are currently breastfeeding. Common side effects of potassium iodide are just a general GI upset, so again, nausea, vomiting, maybe some slight diarrhea. You could be allergic to it. You could develop a rash or an inflammation of your salivary glands is fairly common. In the newborns, again, if you give them more than one dose of the potassium iodide, it is very likely that they're going to slide into hypothyroidism, so their thyroid gland isn't going to produce enough hormone, which is a very common cause for brain damage in newborns. So typically a newborn is going to be screened for that, but you don't want to elicit that by giving them this drug. So other drugs, aside from the potassium iodide, that are available, but keep in mind both of these are available by prescription only, are going to be Prussian blue and DTPA. So Prussian blue has been around since the 1700s. It is used in paint. It is your typical blue color that's found in blueprints. And this is going to bind to a specific radioactive component. So the more common radioactive compounds are going to be cesium, thallium, and then also plutonium. So Prussian blue is known to bind specifically to cesium and thallium. When these are bound in our body, they're then able to pass through our digestive tract, and we're just going to excrete them with our feces. So all this does is it limits the time that our body is exposed to this amount of radiation. So typically the half-life of cesium, for example, is around 110 days or so. By adding the Prussian blue in with it, about 30 days. Thallium, on the other hand, has a half-life only with the Prussian blue. Again, that half-life is going to drop down to 3 days. The reason why I bring up cesium in particular is that is one of the compounds that is typically found in a lot of dirty bombs. So that's when Prussian blue has found its use. Prussian blue is perfectly safe for adults, pregnant women, breastfeeding women, children, as long as they're above the age of 2 milligrams. Side effects of that are pretty much only limited to your GI tract, so again, stomach upset, maybe some constipation, but it is prescription only. The other drug is DTPA. This stands for diethylene triamine pentaacetate. This binds to the radioactive plutonium that I mentioned earlier. There's two different forms. There's calcium DTPA and zinc DTPA. It's said that calcium DTPA is a little bit more effective if it's given within 24 hours after exposure. After that 24-hour mark, calcium and zinc DTPA are proven to be equally effective. So for infants, it pretty much doesn't matter. Young adults or adults in general, the calcium DTPA is preferred. For pregnant women, the zinc DTPA is preferred. Problem, however, with this one, it needs to be administered intravenously, and like I said, it is by prescription only. Another compound that I just want to mention because been researched quite extensively is rosemary. So I read 2 studies that were done in Spain and India, respectively. Rosemary contains 2 compounds, for one carnosol and then also carnosic acid. Both of those are fat-soluble compounds, which makes it really easy for these compounds to pass into our body and also through the lipid layer onto our cells, into our cells. This goes for most essential oils, by the way, which is why they're so effective for us. But by being fat soluble, they can give us protection deep down in our cells.